My name is Danielle McLean. I'm a registered nurse in the ICU department. I've been at the regional for about 10 years, and I've been up here for getting close to 8 years now. The typical stories I find are usually kind of a short turnover, kind of a quick fix that we see. One of the ones that I was going to talk about today was a longer length of stay for someone who was on our unit better part of a year. Someone that came in with a new ALS diagnosis and who was on our unit for the kind of progression to requiring permanent tracheostomy, feeding tube, and 24/7 ventilation. So in terms of providing care for the patient, we had a lot of supports in place to be able to communicate, all the gadgets, everything, but the patient was adamant that they wanted to be able to verbally communicate, and they could only do so by mouthing words. So it took a lot of effort and patience and concentration to be able to have those meaningful conversations. So I do remember basically sweating, trying to take in all the information, having to stop and summarize just to be able to get all the information that the patient was trying to give us. And they were always really appreciative of the extra time, always a thank you, and they'd remember what they told you, so they would kind of build off those stories in subsequent interactions. And because they were here so long, there were many. And then just as a team, the ICU really, from housekeeping, pharmacy, nursing, administration, really took the time to support and personalize the care for the patient. Their dog was able to come up and visit. Any dogs visiting the unit would always make a stop by the patient's room. It made their day. Nurses would provide pedicures, manicures as time allowed, special hair days, movie recommendations. The staff got to know her really well. She was able to make recommendations for vacation destinations. We made an effort to decorate the patient's room according to the season. Toward the latter part of her stay, it was around Christmas time, we were able to put up a Christmas tree. Some kids from the staff on the unit made ornaments. It really, for a difficult situation for the patient, really made it special, really made it something positive despite kind of all the circumstances. So I think it's a really unique story to share.